Hey there, my name is Megan Clanahan. I'm the co-owner of Houston Moms. We are back this month with another monthly health series topic with our partnership, UTMB Health. They are a preferred provider in the Bay Area, League City, Clear Lake, all the way down to Galveston. We have you covered in those areas. And so obviously, this month is October, and it's a great month to get outside. We've got some cooler weather today, but obviously it's also Breast Cancer Awareness Month. And so we didn't want to miss this opportunity to chat about something that's really important to UTMB. And so today I have Jill Resendez. She is an NP with nurse practitioner with UTMB Health. And I have a special guest. It's always super fun when we have patients who are willing to join us and share their specific stories. And so we also have Tina Herring with us today as well. Good morning, ladies.
Good morning.
Good morning.
I just realized as I said them, like it might be afternoon by now, but here we are. We do our best. And so, Jill, I had the pleasure to meet you not probably a month ago at a women's conference, and we got to chat a bit, and we filmed a reel, which by the way is up on our Real Houston Moms Instagram, if you want to go check that out. But she did 3 myths about plastic surgery. So go look at that. But also, Jill, tell us a little bit about yourself.
So my name is Jill Resendez. I'm a mom of three little boys. I work for the plastic surgery division at UTMB. So it's pretty broad, but we offer a lot of services. Me specifically, Botox, fillers, lasers. I get to help women preoperatively and see them through their post-operative course, as well as nipple areola tattooing.
Which is what we are talking about today. And I know when we chatted at conference and when I asked you and this was off the cuff, I don't think you knew this question was coming. When I asked you what was your passion about the work that you do, and this was what you said. And you said this is your life's goal and your mission. And so we're glad to have you here today and share more about what this means, especially as it relates to breast reconstruction and those who have undergone surgery for breast cancer, and how you kind of help them through that process. And so now I'm going to swing to my left, and we have Tina with us today. Good morning, Tina.
Good morning. Good morning.
Can you tell us a little bit about yourself as well?
I am a mom of 3. I work at UTMB where I'm also a patient. I'm a financial analyst, and I'm also a church administrator. And I was diagnosed with breast cancer in 2020, and here I am now today.
Look at you. Tough time to be diagnosed during COVID.
Yes, during a pandemic when you have to do everything alone, when that's the time that you think you need the most people around you. I was isolated, but it all worked for my good and for the bigger good. So I can tell people how to get through, even when you think you're alone and you're truly not. I mean, I knew I had the support of my family and my faith most of all.
Well,
And
yes.
I had Jill and others pulling me through along the way. So it made all the difference.
That UTMB Health family. So, well, we just are so glad that you're here with us today, and that you're looking alive and vibrant, and your pink is on point. So we are just going to launch right into it. I will say there are going to be a certain, to my moms and dads out there watching, and we're going to be talking some pretty specific terms here. And so if you have this on and your little ones are in the background, it's not terms that you are comfortable with them hearing quite yet, or you're not in the mood for explanations today, you may want to just save this and come back to it when it's nap time or bedtime. But we do encourage you to come back to it because we believe this is a very, very important conversation to have. And so in the past, we've talked about, breast cancer and signs and all of that, but we're going to go into something that's a little bit different. And we've kind of teased it. So we're talking about nipple and areola reconstruction, which is what Jill does as part of her very large, broad role at UTMB Health. So can you explain specifically what you do for breast cancer patients who opt for reconstructive services?
Yeah, of course. So I get to see them in their final stage once they've completed all of their surgeries and they've been cleared by their plastic surgeon that performed the procedures. Then they get to come to me, and it's kind of the fun part. It's closing the chapter and starting a new one. So sometimes they have nipple mounds that it looks like they have a nipple, but they just don't have the pigment. So I'll tattoo the pigment in, and sometimes they just have a flat surface with no nipple mound, nothing. And I'll still tattoo that, but you'll have to use the ink to give the projection.
Okay, so I kind of love that imagery of it. You're their last step into like kind of, being the final door, hopefully, that closes on what is, very scary and long and arduous journey. So I have to ask, was this something you ever thought you would get into when you enter like nursing and nurse practitioner and you're like, I want to tattoo some nipples? Like, was that ever in your brain?
No, it wasn't. Not even when I accepted the position at UTMB did I know that I would be tattooing nipples and areolas. No, but it's really cool because I would always joke with my dad, like, when I grow up, I'm gonna be like a tattoo artist or something. And he'd be like, oh, Jill. But now I always have these like crazy ideas that nobody ever thinks will come true, but somehow I make it happen. So it's amazing. I love it.
That's so incredible. And so this is something that UTMB Health offers. Do you know that, are there many other facilities that offer something like this where they're passed on from their plastic surgeon to you?
I think there are, like, from what I've seen in the research, there are, but I don't know if they accept insurance. I think it's all out of pocket pay for those. And I don't think it's associated with the facilities or the hospitals. It's outside source that they'll send people to. But as far as trained in their facility and accept the insurance, I don't think.
So I think that's really important. As we always do these videos, we talk about how wonderful UTMB Health is at comprehensive care. And Tina, this is probably something that you've experienced. You have your primary care physician, and then the worst case happens. You have a breast cancer surgeon who we've met a couple in here as well, and then you have a plastic surgeon, and you guys kind of seamlessly go through the line where all your healthcare stays at UTMB Health. And it's something that I love about what you do. So, and just quickly, can you explain what the process looks like for somebody who is at this like end stage, we're ready to like punch the card and get the nipple or the areola tattooed on? What does that look like for them? How many treatments does it take? All of that.
So for me, when I did get to the nipple processing, the nipple tattooing process, which I didn't even know was a thing, I had to do some Google. I'm like, okay, I'll nod and say, oh, okay. And then I'm going like, what are they talking about? What does that even mean? But then there's someone there all throughout the process that explain everything to you, and it goes from one person to the other. But the good thing about it is they all work together. They all have talked together. They all knew about me before I even got there and what the need would be. And so by the time I got to Jill, I was very comfortable, and they spoke highly of her. Because I was like, okay, well, what did she mess up? What a tattoo for me in my mind, that sounds permanent. And then you hear all the horror stories, not about nipple tattooing, about misspellings and all those things. But how do you tattoo a nipple was my thing. But I was assured that it would be fine, and it was. Jill, I was comfortable with Jill. She explained the process to me before even getting started. We had an initial consult meeting, And so she explained the process, the coloring and how it would be done. And I think it took me three tries, two appointments after the initial. And it was fine. And it was a lot for me. I don't know if people realize how important that is, because it's not just about having a nipple. It was about me feeling like a woman again in my self-confidence, because I began to begin depressed, and I wasn't comfortable even around my husband. And then for some reason, I know I'm dressed when I go out, but it felt like everybody was looking at me and everybody knew I had one nipple, and it bothered me. The mental aspect of it, and just for her taking the time into doing it and just coasting me through everything. I mean, it was wonderful. I'm glad that I did it.
That's so wonderful to hear. And I can't even imagine how emotional that must have been. I mean, you've already gone through the treatment and gone through all of that, and then you're like, but I still don't feel like me.
Yeah.
I think it's great that something like this can give, a little bit of you back to you. Jill, is two to three about the average for visits to have this done, or what does that typically look like?
Yeah, so the first one's always the consultation where, we have to request from insurance the approval to do the procedure and order the supplies and stuff. But I do tell people it's a journey of the tattooing procedure. There are a couple reasons. It is a flap. It's not your normal natural skin. It is, but it's obviously been through a lot. So depending on how your flap takes the ink, depends. And sometimes I've had people that, just had the nipple mound and they got the tattooing done once and they were happy with it and that was it. But sometimes it does take 2 sessions, and a couple of times it takes 3, if you kind of build the ink and see how it takes, and then you can add in the finer details. But yeah, typically I'd say the average is 2 sessions to really get the ink in there, see how it takes, and then go back once it's healed and add a little bit more.
And I think that's such an important point too, is that, these breasts have already been through so much. And so what an interesting, how skilled you must be to be able to get it just right for your patients. And so Tina, I know you kind of alluded to just kind of feeling like it was getting back to yourself. And I know every, breast cancer patient has a different journey, but what would you tell someone who is, maybe going through a similar journey right now? Maybe they're a little bit further back and they're, still completing treatment, but they're in the researching process of looking into nipple and areola tattooing. Are there any words of encouragement or things that you would recommend to them as they're kind of researching that? You mentioned you did a lot.
So the question that I would get asked when I got to the end of the process, okay, you've survived cancer. Aren't you satisfied? You should just be thankful. Getting this done does not mean that we're not thankful. I'm very thankful. I'm very appreciative. I know so many people that did not survive. So I'm thankful for that, but that doesn't mean that we have to settle and that we have to be satisfied with where we are. We can always improve ourselves. And I think that every woman should know that. Be selfish. I mean, at this point, when you've made it to this point, you deserve it. Be selfish and take the time to do whatever it is that you want to do with your breast, and know that it's okay. So that's what I would tell. Keep going.
Amazing. I mean, yes, ma'am. Like, treat yourself, right?
Yeah.
Now this may seem, because you've been through breast cancer and you've been through all the treatments and the chemo and radiation. I'm not sure your specific path, but assuming it was not painful, can you kind of speak to kind of the pain level when it comes to the tattooing process, and maybe how it felt for you? And then Jill, if you want to talk a little bit about what also that healing looks like, because I may or may not have a couple of them and they weren't pain-free. So I'm just curious.
So I had the DIEP flap done. So my stomach was now turned into my breast. So there's not a lot of feeling in that area. So it wasn't painful for me at all. It wasn't at all. But I mean, I'm like you, I may or may not have others, and this is worth it. This was worth it. Even if there were pain, it was, but there's not any pain. for most people, for most women, there will not be a pain because of the way the area has been, all the trauma that area has been through already. So it was
That
pain
makes
free.
so much sense. The nerve
And it
and
was worth it.
Jill,
Yeah.
would you agree with that?
Yeah, so a lot of the women do not have feeling, and if they do, it's very diminished and pretty tolerable. So that does work to our advantage, but I have used the topical lidocaine. You let it sit for 30, 45 minutes, and then it makes it more comfortable for them. So.
Perfect. Well, I know we have covered a lot in a kind of short amount of time, but we wanted to get the hot spots to y'all. Jill, let's start with you. And anything that we missed about what patients should consider when if they're thinking about nipple and areola tattooing.
I think it would be worth it for everybody to, even if they're on the fence or hesitant or kind of like, I'm just over everything, I'm past this, I just want to put this behind me, I don't even care, which everybody has different feelings at their point, but it would be worth it to go have a consultation, and it might be what gets you to feeling great about yourself, and that you're not reminded daily about the scars and not feeling like a woman. That just because you have a consultation doesn't mean you have to go through with it, but you can hear about all of your options, and it might make you feel better about yourself and where you're at. It's always worth sitting down and just having a talk.
Yeah, having the conversations, getting the information, and I assume they would contact the plastic surgery at UTMB, right? Referral likely from the breast cancer surgeon, my guessing.
Yeah. Okay. Yeah.
Perfect. And we'll make sure to drop that link below too. So people can check out just not only obviously that, but you guys cover a plethora of services over at your plastic surgery center and that are worth looking into. And and I think as we've kind of spoken about, information consultation never hurt a thing to be able to get there. Tina, it's amazing to see you doing so well. I know we talked a little bit about your journey. And is there anything that you would like to share that relates to, kind of the tattoo process, the areolas, and anything we missed?
If possible, one thing helped me was I knew somebody who went through this process, so I was able to go and see somebody who had done it, and she actually let me look at it, and I asked questions like, do you mind if I touch it, and those kind of things. So if you can find somebody who has gone through it and doesn't mind sharing, and most women don't, that helps a lot. So that was a big advantage to my side. And UTMB hooked me up with that person, so they put me in connect with somebody that did it already. So that was a big success. So just ask, is there someone that doesn't mind speaking to me, someone that'll let me see? Just ask, and I'm sure there is.
That's awesome. Women supporting women, like,
Yeah.
they're like, hey,
Yeah.
we can just, if this wasn't like a G-rated show, it could be like, no.
Right.
But what a generous use of their time. And also you being, willing and to investigate that further, I think is a huge testament. And we are just so thankful you are doing great. Where are you now on your breast cancer journey? What does that look like for you?
My breast cancer, so I've had since 2026, since my mastectomy, I've been to the operating room 11 times. I'm done now with all of my surgeries. I am cancer free. I'm done with chemo. I take the chemo pill. I'll have to do that for 5 years, but I am good. I am good.
Yeah. That is like, tears in my eyes. I'm so thankful to hear that. 11 times to the operating room. Man, I that's a warrior right there. That is a warrior right there. And Jill, thank you for the work that you do. And I think it is very important work. I love that UTMB has it available for women. And so they don't have to do one extra outside thing. So kudos to y'all and your department and for it being your passion to pursue it. And we're just so grateful. So we are going to drop the links below on everything that we talked about. And if you don't have a primary care physician, this is something I always urge you. Every time we close out this video, please find one, because this is how you have a close relationship with your PCP who can diagnose or help you, like if you're having problems, and get you to the right place within UTMB Health or your health practitioner, so that if there's breast cancer, God forbid, in your future, other things, they can get you into the right departments as soon as possible, and you can have wonderful care from people like Jill Resendez, and you can be a success story like Tina. So I thank you both so much for sharing your time with us today during this very, very important month. Thank you.
Thank you. Thank you for having me.
Okay. We'll be back next month with another important health topic that you guys want to know about. And, as always, we encourage you to check out UTMB Health, especially down in the Southeast Bay Area cities, and find a practitioner that you feel comfortable with. It's always our joy to come to you every month. And until next month, we will see you then.